Uganda.
This isn't just a girl. She is the future. This is a teacher, a doctor, a community leader, our future president.
She is our family's pride, and as her father, I will protect her from child marriage and talk to her about the dangers of teenage pregnancy. We each have a role to play in empowering our teenage girls to protect them from child marriage and pregnancy, because when we empower them, we empower our nation. Protect the girl, save the nation.
Take action. Report any case of defilement or child marriage to the police or call Sauti 116. UBC, inspiring Uganda.
UBC is the national public broadcaster. We educate, inform, entertain, and inspire our audiences. You can watch us on free-to-air channel.
According to Open Borders, Uganda is the most refugee-friendly country in the world and is one of the largest refugee-hosting nations in the world, with 1,495,688 refugees according to UNHCR. The government's policies provide rights to the refugees, such as rights to education, healthcare, clean water, work, private property, and other basic social services. However, a number of challenges arise from the burden of hosting an ever-increasing number of refugees, including the pressure on social services such as education, health, and water, the increased competition for economic resources, and the degradation of the environment. The government has provided solutions to these challenges through the Development Response to Displacement Impacts Project, abbreviated as DRDIP. This documentary focuses on the contribution of the project to the health sector and the lessons learned in providing much-needed infrastructure that has led to greatly improved health services in refugee hosting communities.
This project has three main components targeting community investments. Component one, which I head, is the social and economic services and infrastructure. In short, it is called SESI. Component 2 is sustainable environmental management, and component 3 is a livelihood support program. The project has invested heavily in refugee hosting districts in many sectors that include health, education, roads and bridges, water and sanitation, just to mention a few.
Initially, before Dr. Drdp actually gave this support, our indicators were down. OPD attendance was low, below 1 per capita. Our theater services operations were few, and besides that, the inpatient services were also low.
We are having more mothers than before. Like now, we can have only normal deliveries per month, may go up to 150, 160. And per month, this time we are going up to 40 Caesars. While in the past, it was difficult to have such numbers. And for us, this is a reflection of the services which has been provided here. The influence of this infrastructure made the government to uplift this to hospital status. What does it mean? It meant even increase of what? Of health workers. By the time this project was starting, I want to tell you, I was the only doctor in this hospital. But now, we are 6 doctors.
We have had water sources built, we have had roads rehabilitated to to ease movement and communication across the district. We have had a number of schools, very, very good schools, the first of its kind, built in the district, and we have had a very wonderful health unit built at Chargashu Health Unit. With Dr. Drdp intervention, we have had tremendous improvement in infrastructure. We have had tremendous improvement in the services. The hill has changed, the services have improved, and generally the situation has been turned around.
We've observed that there is improved OPD attendance over time. When we did an assessment in 2018, there were about 110,000 patients who were attending the OPD, but as we speak now, we have up to 150,000 patients that are attending the OPDs. There is also improvement in the response to emergencies, largely because of the staff accommodation that we were able to construct.
Dr. Drdp has been of great help to this health facility. As I talk now, we have two projects. We have Doctor's House, which has been built, completed, and in use. And in this current structure where we're seated, this is the general ward, which is also a project under Dr. Drdp, although we have not yet fully started using it. But if you look at these projects, they have impacted a lot toward the health service delivery.
We used to have one block, actually two, OPD, then one block that one labeled maternity. They used to put all the patients there, whether you're male, whether you're adult, you're a child, they used to put all of you there. But when Dr. Drdp came in, we got some relief. When you enter this ward of ours, we have pediatric ward inside, we have female ward inside, we have male ward inside, we have maternity inside, we have postnatal inside. It's all in this block. Which block has been given to us by Dr. Drdp. I give much thanks to Dr. Drdp for their project. We are having not more than 15 patients, but now we have got so many patients. We have got refugees coming from Nachivari. Almost a day we can receive 15 refugees. Patients are here. Polio is done here. Today is Saturday, you will see how women are carrying this. So the service has improved.
Hatitwe nk'abacyaro ba Chargashu tukagira kusima munonga bukutumbesherirwa rere aho twatuye no kuhendeka kurwa tukaza rwashikara ukikayo mwajiroti ukashangudine nakasente ko kuyamba ngo kumarire mukata turi no kusima munonga bw'ubuherezo batuhiri twatuye nakarwaro harayife mwenu kakakatari nakarwaro ngo karoma yoteri ni rwaro katwatera kusi Dr. Drdp izire kajensi ikatumbeshero gumanya hate ntusimo kure ngo mukaze na ijamba zaraho ucebereza indwara yo niyo kuboyine no buru mushije bakora kurra ebinte byo turi mu bitushimeza munonga.
Drdp has constructed 38 OPDs, 30 general wards and 17 maternity wards, 967 meters of fencing facilities and construction of 3 operating theatres among others within the 15 targeted districts. This has seen a 22% increase in the number of patients triggered by improvements in health facilities, which changed the attitudes towards health-seeking behaviours, causing both Ugandan nationals and refugees to access better health services. These high-quality facilities have attracted more health workers and increased the confidence of the patients in the services offered, and have also led to better relations between the refugees and host communities.
We have seen roads within the settlement recently. We got a 30-kilometer road, the Kituti Malembo Road, Nyamiganda Road, and it is helping us because previously the roads in the settlement were too bad. we would get stuck. Accidents were so frequent, but these days they have reduced, and the roads, you use them, they are smooth, they are okay.
Under the same component of social economic services and infrastructure, the project has rehabilitated or constructed many roads and bridges. These roads have helped beneficiaries access health centers, which are another way of providing access to social services.
When you compare our Dr. Deep roads right now here with the other roads, you really see difference. Those days you will realize if a mother is referred from maybe Lurujo, this is one of the refugee housing facilities, coming to Koboko. By the time the mother reaches the hospital, maybe complications have developed because the roads used to be very bad and driving takes time. But right now, if a patient is referred from Lurujo to Koboko Hospital, it will not even take 20 minutes. This patient will be supported. The roads are very clean and very smooth that it fastens the referral. You will find that the referrals are very quickly and the patients have been supported, especially mothers and other emergency patients that have been referred from the hospital.
Since this road was constructed, at least I have seen that there's a great improvement. As to me, I'm no longer scared of crossing this road, basically to me, because previously when it rained heavily, crossing was a problem. Now at least, nowadays I can pass freely, no matter how heavy it rains, I can pass freely without fear. Even like the pregnant women, they are no longer scared of the road. Moving to the health centers freely, it has even secured our lives at the moment.
Under Drdp overall for the 15 districts covered, inpatient numbers have increased by 22%, of whom 56% are women. Attendance at OPDs has increased by 20%, of whom 68% are women, and immunization coverage grew to 37%. Despite feeling safe and secure and having the same access as locals to basic services, nearly half of the refugees still live in grim conditions and endure high poverty levels as well as those within the host communities.
2018, Changwali was operating in numbers of 35,000 refugees. Right now, a few years after, we are looking at 128,803 individuals. That's quite a big number in increment. So that means there is pressure on every sector. There is pressure in hospitals because the numbers have increased, on medicines, on staff, on accommodation, on other structures, the hospital structures. So if there could be an intervention that comes to capture a bigger percentage of these numbers, or that looks at the increase of numbers of these people, it would help us as actors who are managing these people.
While there are still many challenges, the Office of the Prime Minister of Uganda and the World Bank, through Development Response to Displacement Impacts Projects, DRDIP, is working to improve conditions within the settlements and host communities to help refugees and host communities progress together through this groundbreaking development-based approach. DRDIP is a 5-year multi-regional project covering 5 countries through the Intergovernmental Authority on Development (IGAD) framework. It is funded by the World Bank and implemented by the Office of the Prime Minister. DRDIP provides development and direct income support to the vulnerable households within refugee hosting districts in Uganda.
UBC, inspiring Uganda.
UBC is the national public broadcaster. We educate, inform, entertain, and inspire our audiences. You can watch us on free-to-air channel 001, DSTV channel 282, GoTV channel 371, Star Times channel 201, Zuku TV channel 20, and Azam TV channel 350. Even when your subscription expires, you can still watch UBC for free on your pay TV platforms.